You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am super excited to again bring you Dr. Stephen Ferrara. Dr. Ferrara is a nurse practitioner with over 20 years of clinical experience. He currently serves as the president of the American Association of Nurse Practitioners and is the inaugural associate dean of artificial intelligence and professor at the Columbia University School of Nursing. Dr. Ferrara has held leadership roles in various healthcare organizations and has a diverse clinical background. He is also the editor-in-chief of the Journal of Doctoral Nursing Practice. During his tenure as the executive director of the Nurse Practitioner Association, New York State, Dr. Ferrara played a key role in eliminating barriers to NP practice, culminating in the passage of the landmark NP Modernization Act in 2022. This law removed the requirement for collaborative agreement between experienced NPs and physicians, granting full practice authority in New York State. Dr. Ferrara's commitment to quality care is demonstrated through his passion for healthcare technology and his efforts to integrate evidence-based practice into daily healthcare. His leadership has been recognized with several prestigious awards, including the American Association of Nurse Practitioners New York State Award for Clinical Excellence, and his induction as a fellow of the American Association of Nurse Practitioners, the National Academies of Practice, and the American Academy of Nursing. Welcome back to the show, Dr. Ferrara.
Ali, thank you so much. It's great to be back.
Awesome to have you. I'm going to start with talking about your, congratulations, by the way, on your presidency for the AANP. Let's talk about that role first, and then I have some other questions I want to throw at you.
Sure.
So you've been in the role a little over a year now.
That's right.
So let's talk about what have you done since you've been in the role, and what do you want to do before they kick you out?
Before they shove me out the door, right? So I've had the luxury of having some great experiences as president. I think that the first one was, I became president in June of 2023. And a week later, our government affairs folks called me up and said, we got a White House invitation. So I said, oh, okay. Yeah, I'd love to go. So it was an invitation to, certain groups. And it was talking about, the president was talking about the price negotiation of Medicare drugs. And it was great to be there. I mean, I was in a room with colleagues from other nursing organizations, other healthcare organizations, and president was right there 5 feet away speaking about the new initiative, and it was just great to be there. So it was a great experience, and then it ends, and then you leave, and you're like, wow, I was just in the White House. So it was really cool. And, that was week one on the job.
So I know you travel a lot and you do a lot of speaking engagements with various organizations and within the nurse practitioner realm.
Mm-hmm.
And with the understanding that there are various scopes of practice depending on state laws,
mm-hmm.
How do you see the practice not only differ, but the impact of nurse practitioners in the states that do have full scope of practice?
Yeah. So, the challenging thing is that we currently have 27 states that are considered full practice authority, right?
Right.
So nurse practitioners in those states do not require a written contract with any other provider in order to offer services. And we know that in those states, healthcare access is improved. We know when the states have they have those rankings that come out of what are the healthiest states. In my mind, it's not a coincidence that most of those states on that top 10 list are full practice authority states for nurse practitioners. So, we see this as, a considerable archaic barrier to practice. And there's no fundamental difference between a nurse practitioner in a full practice authority state versus one in a reduced or restricted practice authority state.
Right.
The difference is the state law, which is our Nurse Practice Act, which we're bound by, and that's kind of dictates what we can and what we can't do. You could practice for 20 years in a full practice authority state and then end up moving, right, because of
Right.
life circumstances and go to a reduced practice authority state, and all of a sudden need to have a contract with another provider in order to do the same job you were doing for 20 years. So
Yeah.
it doesn't make a lot of sense to me, but this is how practice needs to be legislated. It's at the state level, and we just need to work in all those states that do not have it to convince them overwhelmingly that when full practice authority is passed, there's an increase in the nurse practitioner workforce. There's an increase in access, and it's a win for patients.
What's the biggest barrier that you've noticed for that full practice authority to be legislated? Like in my head, I'm just because of my own experiences, some of those barriers are led by what physician lobbyists that
Mhm.
think that nurse practitioners are taking over their role, which
Mhm.
that just goes to show they don't understand the role of the nurse practitioner.
Right.
And then there's other, like those historical archaic things, like they've always had it this way, and why should we change it, right? They just don't understand the impact of a nurse practitioner. That's in my head and based on my own experience. What's been your experience as to barriers talking to these various states that don't have full practice authority?
Yeah, I think you're pretty spot on as to what the barriers are. I think somewhat it comes down to of a lack of understanding of the role of the nurse practitioner. We're different. We go to nurse practitioner school. There's our path is different than other colleagues. So I think there is a misunderstanding of that to stakeholders, to lawmakers. And I have to say there are champions out there who understand NP practice and support it and want to see nurse practitioners practice without arbitrary restrictions, and, as we like to say, practice at the top of our licenses, right?
Exactly.
But I think a lot of it is perception or misperception of the role, and it's change, right? It's something different. And I think that is always a concern for anybody in a position to make a change. But my belief is that the practice of what we do is not we're not seeking to change. We're not
Yeah.
looking to do more or less than what we do today.
Yep.
Just we want to be able to practice without this sort of without a barrier. We want to modernize the laws so that they could be updated to be consistent with access to care today.
Yeah, that makes sense. Now, from one of the things that's been brought up numerous times has been this whole idea of physicians looking at nurse practitioners as sort of an extension
Hmm.
of their role. How much of that do you think plays into the fact that the traditional role, and I'm air quoting for since
Mhm.
this is audio. So I'm air quoting because nurses historically have not necessarily, with the same issue with just registered nurses, have being seen as extensions of what physicians do, as opposed to nursing being its own profession with its own independent practice, right? So from that perspective, what are we, how is that also, those traditions are playing a role here?
Yeah, I think the difference is that we are a profession, and I think when you think about the definition of a profession, that it's a educated workforce that regulates itself, right, through a board of nursing and through various entities. Um, I think saying we're extensions are shortchanging what it is we do, right?
Right.
We're not technicians. We have a body of science that we base ourselves, base our practice off of. And sure, there's overlap with other professions and whatnot, but nursing is its own profession. So I would reject out of hand to say that we are an extension of anyone.
Right.
We are a profession of advanced practice nurses as nurse practitioners, and bring a unique skill set and experience to the patient care space.
Yeah. Now I'm going to ask you a quick question, just because not too long ago I had an experience with it with a provider or a physician.
Sure.
I understand they don't like to be called providers for some reason. Uh, um, and they, because we were talking about how to keep nurse practitioners, advanced practice registered nurses, engaged with a bachelor's degree and associate's degree nurses, to help with the professional development for those who are looking to go into advanced practice nursing.
Mhm.
And they couldn't see the connection between APRNs and registered nurses, because they're like, oh no, they're now providers. They're not registered nurses, right? So how does, with the understanding of uh, advanced practice RNs are still RNs,
Sure.
what does that skill set look like, or how does that practice differ for a nurse practitioner, that they are still registered nurses?
Right. I mean, my own sort of take on this is, as registered nurses, we have this idea of patient advocacy, instilled upon us, right?
Yeah,
We are patient advocates, as well as, providers of nursing care.
right.
And I think that that doesn't go away when you become a nurse practitioner.
Mm,
And and I'm not saying one is better than the other, or I think that when we look at evidence, outcomes are the same, right? So
right,
let's keep that at top of mind. But
right.
when if it all it was, if it came down to was treating an elevated high blood pressure, right? Um, like that would be easy, right? That would be like we have certain medications, antihypertensives, that can treat hypertension, and you pick one based on the evidence and the guidelines, and the patient should improve. But the reality is that doesn't happen uh, very often, right? There's the social determinants of health that impact a patient being able to access medication, or being able to access transportation to get to their healthcare provider's office. So, you know, I, I think that's instilled. I know that's instilled with nurse practitioner. So
Yeah,
it's not, here's a medication, take it. It'll improve your blood pressure. It's, here's a medication. Let me make sure your insurance covers it. Let me make sure you can get to the pharmacy. Let me make sure you can afford it. I mean, I think any clinician of these days, any prescribing clinician should be doing that, right?
right.
So I think that's kind of what we've been conditioned to do. But I think that's at the core of what of what advanced practice nurses and nurse practitioners do. And that's where they bring that nursing experience into the fold.
Yeah, it's not secondary. It's just part of the primary care that they provide.
That's right.
That holistic look. So I appreciate that. Now recently, the number of required hours for training for nurse practitioners increased. Do you think that change, first of all, was necessary? And then second of all, how do you think it's going to change the perception of new nurse practitioners going out into the community?
Well, I think we're seeing a converging of different issues when it comes to education. One of the things that is happening in education fields right now is competency-based education, right? Competency-based. And it doesn't really, the emphasis is on making sure that that student meets that competency versus a requisite number of hours that that person needs to, be in, whether they are getting the content and the skill or not. So, I think, competency-based is important. I think that can sort of allow, the public at large to know that this provider class has been experienced in these certain areas to fulfill as a graduation requirement and have met those competencies, right? And therefore are graduating with a skill set that they're, haven't ever seen X scenario in their studies. So I think, sticking a number on clinical training is probably not the best way to evaluate whether that's adequately prepared person or not, but actually having some criteria to fulfill in order to say, yes, this person is competent, and that's a good thing at the end of the day. We're going to always be required to have additional training and additional hours and additional, it's how we become, re-credentialed and re-board certified and all these things. So you don't just stop learning, once you graduate. I think the expectation is you have to continue that along. And what's the best way? I think that's where we're looking at it. And again, we want to ensure a workforce that is competent, that is prepared, but knowing that a novice clinician is going to be a novice,
right?
No matter what field they're in. So the key is going to be, making them as ready as possible, making sure that they have the resources available for when they do practice to become, novice to expert.
Yeah, that makes sense. That makes sense. And I agree. And I think it goes back to the idea, and I don't know how much of this based on pressure from the community or other organizations that were harping on the fact that, nurse practitioners have X amount of numbers of training hours while they're in school. And I don't know how much of this had to do with the fact that this was sort of maybe a knee-jerk reaction to those things. And then the same thing like we're facing with on new RNs going in the field of this them being practice ready. Which practice ready for me doesn't make sense. And I know it's, some people are like, oh no, our nurses need to be practice ready. Same thing with APRNs. I'm sure like they want them to take a full load of patients day one out of school after they get licensed. And it's not realistic. It's not a model that makes sense. So I think a lot of it, some of it may have to do with that also.
Yeah, I agree. And again, I think we see all different ways of setting up that newly graduated person, and again, I think it's responsible on everybody to make sure that they have the resources and support to be successful in those roles. And if they're not, they shouldn't work there.
Yeah, I agree. All right. I'm gonna switch. I'm gonna switch a little bit off of your. I'm gonna take the presidency hat off of you for
Okay.
a second. I am really interested in some of the new work that you're doing
Uh-huh.
with AI.
Yeah,
With you're at Columbia. You're at Columbia, right?
I
I'm
am.
just
Yep.
making sure. Just making sure. Well, you're at Columbia, right? All right. But this work with AI, because I recently enrolled into a couple of courses
Mhm.
that had to do with education and incorporating AI.
Sure.
So I'm finding it very interesting, but your role specifically, and this is probably, I haven't seen it anywhere else.
Mm.
Tell me about this role and what are you doing with it?
Yeah, it's really interesting. The I attribute the vision to our dean here at Columbia University School of Nursing, Dean Lorraine Frazier, and we have the understanding at the university that AI is important, right? And AI is going to be a strategic focus of all the schools at the university.
Mm,
Um, and, I probably will say that outside of like the School of Engineering and some of probably the School of Engineering, there really isn't an analogous role that is like mine throughout the university yet. So I've come across a lot of people and they said, "Wow, you're associate dean of AI. That's pretty interesting." And it is interesting. And I don't proclaim to be an expert in the programming of AI, but I don't think this role necessarily requires it, right? And I'm going to use an analogy I'm stealing from another webinar I was on, and that you don't have to be a mechanic to drive a car, right?
right.
You don't need to know how an engine works, but you do need to know the laws of physics, and you do need to know some basics in order to successfully and safely drive a vehicle. So my role is to build upon the three pillars of this at the School of Nursing. And our three pillars are academics, research, and clinical practice. And make sure that AI is integrated seamlessly into all of those three areas. So first off is being able to speak with our faculty and have the conversations about what is AI. Let's use AI and kind of demystify some of it.
Mm,
So how can we incorporate AI into assignments? Also on the academic side, I have a student advisory council that I didn't know how many students were going to be interested in this, right? I said, well, we'll pick 5 students. Well, I got 24 applications in like
wow.
a weekend. So I said, okay, there's definitely an interest here. So the other component is being able to speak to AI to students so that studying is more efficient, that they could focus on the things that are troubling them, that they're having difficulty learning, and also prepare them for the clinical world that is going to be AI incorporated, right?
Yeah.
Because we're going to be increasingly seeing these tools at the clinical settings. So that's the education piece. On the research side, Columbia Nursing has had some nurse researchers who have been focused in machine learning for years. So I am helping to augment their message and amplify their messaging. So I don't anticipate myself doing any sort of extensive research, but how can we take their experience and really merge that into clinical settings? And then the clinical space, not necessarily implementing AI solutions and tools, which there are so many these days, right? There's like you turn around and there's another AI medical company that has popped up.
Right.
But again, how can we teach clinicians how to use the technology as a resource and not have, know the limitations of it, know that some basics of how the model was trained, and making the decision at the end of the day all right, this is a data point that this AI tool is generating. Is it relevant for my patient? Is this something that I can apply or not? So
Mm,
those are sort of the areas that I am responsible for, and it's been, I started this role in July of 24, right? So it's only been a few months, and it's been an interesting one so far. Lots of innovation out there, lots of excitement, and of course a lot of concern because we don't want AI taking over every aspect of our lives, but
yeah.
but I think there's I think there's the power of this technology being transformational in healthcare, and I'm excited.
Yeah. And I know like some organizations or technology organizations like Epic are starting to incorporate some AI components into
Yep.
their software, which requires a human oversight, but still the fact that they're doing that is pretty telling that it's not going to go away. Now I have a question for you. I have been very when AI first came, like AI, well, AI has been around for years. I shouldn't say when it first came out.
Correct. Yep.
But when it really emerged through like things like when ChatGPT and those kinds of things kind of came about, I know a bunch of faculty automatically panicked that
Mhm.
anything they were doing was going to get people are going to be using this to write all their papers and write all of this stuff. And my thing, one of the things I shared in the beginning, I was like telling them, I'm like, learn how to use it inside your classroom because this could be a game changer
Yep.
as to how you're. So I know for some people who are like PowerPoint test paper, uh, like those individuals panicked, and for anybody who's that's their methodology, don't message me about this, but uh, you're not going to change my mind on that being archaic way of teaching. But uh, but for the reasons of like something like this, and now I'm seeing some emergence of a good number of institutions putting out these webinars of
Mhm.
the dangers of AI in academia or education and things like that. And I'm like, why are we on this bandwagon of this dangerous for we're not going to get the same quality as opposed to learning more about it in a way where we can incorporate it into the studies. So
Right.
have you gotten any of that? Or I just saw a webinar thing yesterday from a fairly well-known organization with
Yeah.
like, I don't know if it's supposed to be like something that scares people into paying and listening to this webinar, or is it something that you're seeing as you're in this role?
Yeah, I think it's a great point. I think it's, a little bit of a clickbait, right? AI is taking over
Right.
everybody's job. And if we were around when the calculator was introduced, I wonder if the same webinars, although they weren't having webinars back then, the big old calculator is coming out to, replace all of our jobs. I mean, I think some of it again it's the fear of the unknown. It's going to require faculty to reevaluate the way that
Yeah.
they teach
Yeah.
and the way that they evaluate their students, right? I think we have to still know how to write a paper, right? You
Yes.
need to understand that you do research and you need to attribute quotes and you need to put together a coherent, argument, if you will.
Right.
Um, but is that the best way? Should we be doing papers for every class, right?
Yeah.
Probably not, right? And some of the ways that I've already heard of professors incorporating it is have they write the paper on the topic, and then the student critique that paper from the AI generated, output. So,
Right.
this way you're forced to know the content and be able to sort of write a counter argument, if you will. So, and that's different, when
Yeah.
you've had your PowerPoints and you have your years of teaching materials. It's gonna be different. And I think that what we need to understand as faculty, as educators, that difference, it's going to be a lot of change coming forward. But if at the end of the day, right, we could really enable and empower students to focus in the areas that they're struggling in,
Yeah.
that they could sort of create these study notes from PowerPoint slides. I mean, that's a good thing in my mind. That there's really no downside to that as long as they're getting the understanding of the content. So I think it's I think there's a scare tactic, but overall, once you start to use the technology, and that's what I would urge everyone to do. Use it, you incorporate it into your daily living, whether you're looking up something, professionally or personally, see what the limitations are, see where it does excel, and, you'll be able to use it intelligently.
Yeah. Yeah. And one thing I'm going to just share, like I do incorporate it into some of the classes that I teach just to help people, because I know it's really a time saver, right? For the students. I mean, the students today are not the students of 20, 30, 40 years ago, right?
Right.
So it's different. A lot of them, especially with some of the schools that I'm associated with, these are students that work full time,
Yep.
right? Like not by choice, but they have to, right? To just keep a roof over their head, put food on the table, all that stuff. So if it's a way for them to save time, just like run AI. I mean, if even you look at, like, I'm horrible with commas. I don't know where the commas goes to save my life.
Right.
I throw it into like Grammarly. I'm like, show me where my freaking commas are supposed to be, like stuff like that. That I think it just helps refine
Yes.
your thought, or run some ideas, have it generate a bunch of titles for you,
Yep.
right? I'm like, oh yeah, that one works really well. Instead of trying to, like, I don't need you to know what kind of what's the best title. Have it generate like 30 titles for you with your parameters, and
Exactly.
pick the one that works best for you. Or
Right. And it is that jumping off point. It's that
yeah,
starting
it's that
point.
jumping off one, right? Like, you get stuck on a chapter, or if you get stuck on a piece, have them write some not write the chapter, but write you some what is it? Like an outline sentences, right?
Sure.
Like, I'm like, okay, this works. I'm gonna, like, again, those things where we tend to lose a lot of students, like in
Yep.
writing, or doing something like that, or they get stuck somewhere. It's just another tool. But if we teach the students how to use, I use it for that. Like, I
Right.
had a talk that I had to give a few months back, and like the person like emailed me. It's like, oh, I need your objectives by tonight. I'm like, I don't even have a talk yet, let alone objectives, right? And this was
Right.
like months before I was supposed to even give the talk. So with ChatGPT, I needed objectives for this talk. So I ended up, just asking ChatGPT. I'm like, give me objectives, and it gave me 3 objectives with my parameters. And I'm
Right.
like, okay, these sound okay. Let me refine them, because it was one, like, me giving a talk on X and having those 3 objectives. Well, those 3 objectives are very much associated with the talk I'm going to give, but
Right.
it was a way for me. Like, it was like 9 o'clock at night. I needed to send this in by midnight. I'm like, this is not life or death. I can use those 3 objectives to drive my work, because I know it's based on my parameters, and I just sent those in. So it's those opportunities where I think having a tool,
Yep.
AI generated tool or something like that, as long as you know the material. At the end of the day, you have to know the material,
That's absolutely right. You
right?
can't fake it. You can't
You
fake it.
can, because sometimes ChatGPT does make stuff up,
Yes.
right? So
Yeah.
it does make stuff up. I'm going to put it out there. So you have to know the material. You can't just not know the material and depend on an AI tool to do it for you.
You really do. And you probably even sort of shortchanged yourself, because the parameters of the prompt that you put in probably had more detail in it than you give yourself credit for, because just spitting out 3 objectives is easy, right? It
Right.
could give you 3 garbage objectives. And one of the biggest things I tell new people that I'm trying to encourage them to use one of the AI models is, this is not Google. You're not putting in a search term. You're actually putting in a prompt that this is what I want you to focus on. This is what I don't want you to focus on.
Right.
This is who I am. This is the audience I'm giving it to. And so you're already putting in some work, but the better your prompt is written, the better output you're going to get.
Yeah. Yeah. And so yeah, as long again, at the end of the day, you have to have some expertise or
Yes.
knowledge on what you're doing and using it as a stepping off point. I'm
Yes.
okay with that because I know that's some people's like worst moments is like, how do I get, and again, as you mentioned, it's just like the calculator or anything else that's come
Yep.
up.
Yep.
It's another tool for us to use. It's just a matter of how do we use it.
Exactly.
Right.
Exactly.
So yeah, so I agree. Um, all right. I just want to make sure we're okay on time. So you have so I'm gonna go back to sort of a little bit more of the nurse practitioner role.
Mhm.
And I'm gonna combine it with AI. So
Okay.
we've talked about both. How do you see AI perhaps changing practice? Because I've seen stuff on TV with the
Mhm.
news with various people doing some great work. How do you see an AI tool helping uh, nurse practitioners, especially since, from what I've read, a lot of our nurse practitioners are serving underserved communities with less resources, rural areas. How do you see AI being another tool in the bat belt of the nurse practitioner?
Yeah, it's a great question. And I think there's a few areas that AI could definitely assist with. And, as all nurses face, and nurse practitioners are face it as well, is the documentation burden, right?
Mm, yep.
The administrative burden of doing tasks that are not directly related to patient care, things that take you away from the face-to-face with your patient, that where you want to spend the majority of your time, but unfortunately you end up spending it in front of a computer, right?
Yep.
So, some of the advances are the ambient scribes, right? So that this is a, listening AI tool that will essentially transcribe the note, the encounter, into a SOAP note with actionable items in it, and it prevents, or it allows that nurse practitioner to not be clicking and typing and trying to figure out how to put that order in, or just the workflows in EHRs are just so not user friendly.
Right.
So I think at the very least, ambient scribes and ambient listening is going to transform the way that we document. And I
Mm,
look forward to that.
yeah.
I think there's also, but again, privacy needs to be addressed. Where is this recording, being held? And, we want to ensure the safety of it, and it's not getting out, you know, being shared with parties that shouldn't have access to it. But I also look forward to like ambient like video as well, right? So like we can document things that are not just by voice, by audio, but procedures that are being done, or documenting wounds, right?
Yep.
Like being able to do that and not have to whip out the ruler, but we can have an actual, camera that is assessing the healing or the grading of wounds. So I think right there, that is going to be a huge leap forward for us, right? Putting together a note so that we could get something pre-authorized, so I don't have to go around and have my templated note and change this and change that, but just have AI assist with the writing of that note. Of course, at the end, I'll proofread it. I'll make sure it's accurate and appropriate, and then send it off, right?
Yep.
The other aspect is, we as clinicians are getting more and more access to data points than we've ever had before. Wearable technology, Apple Watches, Fitbits, et cetera, et cetera. The question is, what do you do with all that information, right?
Yeah.
Like you can record a pulse now 24 hours a day, right? Like have all these, I, as an individual, can't look at that information and trend it myself, right? It would take forever to do that. So how can AI put together these clinical pictures and scenarios that is going to assist me by digesting that information, putting it into a snapshot so that I could now use that information to make a decision based on, the patient that's in front of me. I think that's going to be, a huge benefit. Also with EMRs, right? There's tons and tons of data in EMRs, and like every clinician is not going through every single note. It's just impossible. It would take too much time. So having AI sum those notes and give you some good understanding, is, I think, so valuable, and will certainly enable us to, I believe, take better care of our patients.
Yeah. Now, do you imagine, like at some point, AI, not necessarily diagnosing, but sort of what ChatGPT sort of does right now, it just makes some recommendations based on the data of the patient, saying, hey, you may want to also look for X, Y, and Z.
Yeah,
right?
absolutely. And I there are models that are doing that now. As an experiment in my health policy class this past summer, I said, we're going to have an AI assignment. And I asked the students to take an actual clinical scenario and feed in some of that information, not patient identified, of course,
Right.
into ChatGPT. And, did it come up with the right differential diagnosis? Did it come up with the right interventions, diagnostic tests to order? And I have to say, broadly, it worked pretty well.
Yeah.
And, again, remember, this is also one of the things I've heard a lot with AI. This is the worst that the technology is ever going to be. It's
Yeah.
only going to get better from here on. So
Yeah.
I thought it was pretty impressive. And, there's going to be a time, and if it's not already happening, that our patients are going to come to us and say, I put my symptoms into ChatGPT, and this is what it told me, right?
Yeah.
And we as clinicians can't dismiss that.
Yeah.
Oh, go to Dr. Google, right? Like you used to make fun of that, right?
Yeah.
But now we have this technology that can actually use some kind of, learning logic and, put together based on the data that it was fed to be able to make some good recommendations from there. So it's going to be an interesting space.
Yeah.
That for sure.
I'm in favor of Dr. Google because, that means that patients are genuinely engaged, and they may not always get the right diagnosis, but at
Right.
least they're engaged, right? They're
Yeah.
interested. And I had a physician one time, actually, I looked something was going on with me, and I looked up my symptoms and in Google, and he actually diagnosed myself. And I went to the doctors,
Yeah.
I'm like, oh yeah, I don't, I did a bunch of blood work and stuff, and came back, and I'm like, oh yeah, it was that. I'm like, well,
Right.
so
If there's going to be, typical signs and symptoms, there's always the possibility that something falls outside, the realm of a normal presentation. But I mean, half the battle is getting there, right?
yeah,
It's all in your history. And if we're able to take better histories, better able to match that with the evidence and, less waste, less wasteful ordering of tests across the board. So,
yeah.
you know,
So,
it's going to be great.
well, great. Thank you. I appreciate that. I know I don't have you for that long. So anything else you want to share? Because again, I know this is your second time on the show, and I appreciate you coming on this time in your several new roles, actually. So I appreciate you being on. But anything else you want to share?
I mean, I'm always going to have to make the push for, for your nurse practitioner audience out there to join, your national organization, AANP, as the largest organization for nurse practitioners in the U.S. and also internationally now that we have international membership that launched this year. I think it's important for our profession to maintain that identity, to align with organizations that, support the work that we're doing, and, make sure that we're clearing the barriers that are out there and modernizing the policies, the procedures, the laws, the regulations that prevent us from being able to do all that we can. So join your professional organization. I think the other part is not just join, but participate, be an active participant in that organization. I've heard a lot of people over the years, I joined and I didn't get anything out of it. And I can understand that. We're busy. You have a life, you have a professional life, you have a personal life, you have, family life and all these things. But you probably won't get much if you're passive in it. Certainly there you could take advantage of the continuing education components and all that. But, being able to attend a conference or join a community or a committee, I think people feel much more professionally satisfied that way. So join an organization, become an active participant in it. And and if there's anything that I could do to help facilitate that, I'm more than willing to help.
Well, thank you for that. Where are you going to hold your next conference? So we're talking about 2025?
2025. So we have our national conference that will be in June in San Diego.
Oh, nice.
So we'll be on the West Coast. We're looking forward to that. And in March, we have our health policy conference in DC. So those will be our two in-person conferences in 2025. And if you go to the AANP.org website, you'll see all the pertinent information to look into that and sign up for it.
That's perfect. All right. Well, thank you. Thank you again for being on the show. We have been listening to Dr. Stephen Ferrara. He is a nurse practitioner and president of the American Association of Nurse Practitioners. Thank you so much for joining us, and looking forward to bringing more incredible guests really soon.
Ali, thank you so much. Thank you for what you do to highlight people in our nursing profession, and I think you're doing great work. And again, thank you for having me on again. I appreciate it.
Appreciate you. Thank you so much.
Thank you.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.